Welcome! This video is a basic demonstration of a direct antiglobulin test, or DAT for short. The DAT utilizes the red cell portion of a whole blood patient sample collected in an EDTA anticoagulant tube. Upwards of 4 different reagents are utilized for the DAT: buffered saline, polyspecific anti-human antiglobulin containing both IgG and complement, monospecific IgG antiglobulin, and monospecific complement antiglobulin. To begin, 4 tubes are labeled with the patient's initials and an abbreviated notation for each of the 4 reagents mentioned in the introduction, with the tube labeled CT acting as a control. Next, a 3 to 5% red cell suspension is made, mixing the patient's red cells with buffered saline. 1 drop of the suspension is added to each tube, then washed a minimum of 4 times with buffered saline. Cell washing can be performed manually or with automation. The patient's red cells should be dry, meaning that little to no residual saline is to remain inside each tube prior to adding the appropriate reagent. We will begin the DAT with the control and the polyspecific tubes labeled CT and PS respectively. 2 drops of buffered saline are added to the control tube, while 2 drops of polyspecific IgG and complement reagent are added to the thus labeled tube. These tubes are centrifuged and read macroscopically in the optical aid, followed by a microscopic reading at 100x, utilizing a light microscope. Macroscopic and microscopic agglutination must be absent in the control tube in order for the DAT result to be both valid and reportable in the laboratory information management system. The polyspecific reagent tube is also read with the optical aid, and if non-reactive, is read under the microscope. If agglutination is seen in the polyspecific tube, either macroscopically or microscopically, then that result suggests that the patient's red cells are coated with IgG. For this demonstration, the patient's initial DAT results are negative for both the control and polyspecific tubes. The next step is to incubate both tubes for 5 minutes at room temperature. The tubes are centrifuged, and starting with the control tube is read both macroscopically and microscopically where no agglutination should be seen. The polyspecific tube is read macroscopically, and if non-reactive, is read under the scope. Coombs check cells must then be added to confirm the results for a non-reactive polyspecific tube. If agglutination is seen in the polyspecific tube, then the addition of check cells is unnecessary. Agglutination seen during the second rating suggests that patients' red cells are coated with complement. With a valid saline control coupled with a reactive polyspecific result, it is necessary to complete the DAT with the monospecific reagents anti-human IgG and anti-human complement. 2 drops of each reagent are added to the appropriately labeled tube, centrifuged, and read under the optical aid. Non-reactive tubes are followed up with a microscopic reading. For this demonstration, agglutination can only be visualized microscopically for the IgG tube. Coombs or complement control cells must be added to the appropriate reagent tube to confirm a negative result.